Welcome to T-Minus Attending, and I'm your host, Dr. Shishir Shah. I'm a wound care specialist, entrepreneur, private equity operating partner, proud father, and educator. Our goal at T-Minus Attending is to empower new and experienced medical professionals to lead better and live better so they can fulfill their personal professional lives as they grow into their careers. This is our very first episode. We have some amazing guests that I'm excited to share with all of you. In fact, our first guest is a personal friend, Dr. Timothy Schaub. We'll be discussing positional leadership and the concept of earned leadership. He's a great friend, colleague. He's a proud father of two, husband. He's a renowned orthopedic hand surgeon here at Phoenix Children's Hospital. In fact, he's going to be starting a new position as the chief of pediatric hand and microsurgery at UCLA. He's been voted Phoenix top doctor for several years in a row. He's a clinician of the year. In fact, he has so much free time. In his spare time, he's completing his MBA this spring here at the W.P. Carey School of Business in Arizona. He's published 50 journal articles and presentations. I know him from personal experience, just an amazing guy. He's extremely respected by his staff, his coworkers, and administrators, all of our community. So excited to have him here today. Tim, welcome to T-1. How are you doing this morning?
I'm doing great, Shishir. Thank you very much for inviting me. This is really exciting. I'm excited to be your first guest. This is awesome.
Yeah, absolutely. This is going to be fun today. We're going to talk about a lot of great things, and hopefully our audience can have some takeaways from your wonderful experience. Tim, I just wanted to start, talking to you about, what many of us think of as a leader. At least what I think of a leader, maybe you can help me out, is, it's someone that's maybe a visionary or someone's got a lot of charisma, is able to lead a team through war or through a winning game, an NBA championship or something like that, sinking ship. But, you're a surgeon. You see these sinking ships every day. And some of the best leaders, as I see, are those who are sort of silent, lead by example, often the quiet ones in the corner. They're just doing something for a common purpose. And I think as physicians, we're lucky. We're all have a common purpose that we all went into medicine for. We want to help people. And so that's sort of built into us. But, the concept of leadership and being a leader was really part of our DNA when we became attendings. And maybe you can share with us a little bit about how you see yourself as a leader and sort of how that's different than what our perception is as a leader.
So that's a great question. And I think leaders, as you mentioned, really come in all shapes and sizes and situations. I don't think there's a true mold of saying this is what a leader needs to be. It really depends on the situation. I see myself as a leader in every operation that I do, because the patient that's going to the operating room, either the patient or the patient's family, said to me, "Hey, I'm giving you trust to take care of my family member or myself." And so that the responsibility is on me. There are lots of other people in the room, obviously, that take part in that, but ultimately I feel like I own that responsibility. And so I think it really comes down to understanding what your responsibility is and then guiding people that are involved in the goal towards that goal. And so be that in developing a team, I think that's one of the things I enjoy most is team building and developing teams and getting people working towards a common goal or a common purpose. And sometimes that's a challenge. Sometimes it's really easy. Some opportunities are easy to get people on board with. Sometimes, it's leading people to change, where significant changes are going to happen within an organization or within the way you do something. And you have to get everybody on board to do that. And so it's a matter of saying, well, this is where we need to go. This is why I'm going to take on that ownership of making sure that happens. And I'm going to support everyone in that group to make sure that we are all on the same page to try to get to that goal. I think, management is managing people. I think leadership is bringing people together to work towards a common goal. And so that's what I enjoy. I enjoy leadership. I think I'm a better leader than I am a manager. But I think that, trying to ensure that people are working towards a common goal, and especially when that involves a patient, I think that's what really leadership is about in medicine.
Yeah, for sure. I think, as you mentioned, it's about going for that common goal. And, the leadership comes across with, if you're sharing that common goal and you're expressing that to your attitude through your body language and your talent, obviously, Tim, you're just a talented person. The outcomes are great. So when people see that goal is actually being attained, then that drives people further as well. And, perhaps we can share with our audience today, because I think understanding the environment you work in and the culture you develop, maybe just share with us briefly what your surgical team looks like when you're at Phoenix Children's and what that setup looked like and what your team was like and, how that really, how you foster that relationship and your culture and environment.
Sure. So surgical team we really have two teams. The way I break it down, one is the outpatient clinic team, and then the OR team. The OR team could be inpatient OR or outpatient OR, but you have the OR team, then you have your clinic team. The clinic team at Phoenix Children's Russ was made up of several people. So we had, I worked directly with a physician assistant. My physician assistant I've been working with for 12, 13 years. And we had a really great relationship and great team collaboration. We also had a nurse, and she also was really imperative to the outcome of our patients, making sure things are followed up on, making sure that the patients had all the information that they needed. We also had a scribe, which was really incredibly important to help increase the efficiency of what is sometimes the most cumbersome part of medicine, which is the paperwork. But having a scribe there increased our ability to have accurate documentation, as well as improving what we're able to document. And then we also had a cast tech. I do hand surgery and plastic surgery. Having a cast tech, someone who could apply casts, take off casts, and apply them safely in children was incredibly important. So having someone that was experienced in that. And then along with that, you have people within the clinic, managers, things like that. They're also part of the team. But creating an environment where everyone felt valued, everyone had a voice, was incredibly important to make sure that communication was open the entire time. So if there was any issues that came up from the and then also the other person that was important is the medical assistant that would room the patient and obtain medical records, things like that. So all those people were incredibly important to have as components of the team. And again, everyone had a voice. Everyone, if there was an issue that came up from a person arriving to the room or going home or calling in an issue, everyone was able to express those concerns, or be positive or negative, to anyone in the team. It's because we had open communication. I made it very clear from the beginning is that, I'm not someone that I want people to feel intimidated to talk to. If there's an issue, I need to know about it, because at the end of the day, those patients are, I feel, my responsibility. And so everyone had a voice. Everyone was able to work together to take care of the patients and be able to impart their own component of taking care of those patients to me or anyone else in the staff to make sure that any issues were addressed. So that's kind of the clinic team. And then when you look in the OR, that's a separate team that involves usually a scrub tech or two, and a nurse and anesthesiologist, and then people within the pre-op area and the post-op area, recovery area. Most importantly, within the OR itself, what I really felt was incredibly important was, again, communication. So again, my PA would oftentimes come to the OR with me. A resident or a fellow would come to the OR with me. And then what we'd do is we'd have a conversation and a clear goal in mind. And it's important that gets communicated to everyone on the team. And so that includes making sure you have the right equipment when you get there. The equipment's available, and we're not waiting for it, because obviously anytime under anesthesia increases risk and increases cost. And so making sure all those things are set up as efficiently as possible, and really having good communication with the team that's going to help provide that. And then also incredibly important is the communication with anesthesia as well, about time, medical comorbidities, any expected blood loss, things like that. So at the end of the day, all these things are about communication. And so having clear communication, understanding that you're approachable and easy to talk to and easy to ask questions of, makes that process a whole lot easier. So I think communication is really core to being a strong leader.
Absolutely, Tim. I think we underestimate or don't discuss enough the value of communication. We hear that about relationships. We hear that about friendships. What you told me resonates me. And we're fathers. We have children. We have daughters. And I sort of see that as a evolving relationship with your staff, where early on you're seen as a leader, the father figure, the mother figure, and they look up to you and learn from you and don't challenge you, question you, kind of follow your lead. But you don't have all the answers, and you're learning with them, you're growing with them, and every case is different, every patient's different, every staff is different, every environment's different. Obviously, your stress level is very, very high. But as they get older, as you work longer with them, as the children mature, you mature with them, and then they become more of your friend than the parent. and you want them to open up to you, and that you want them to talk to you, and you want them to share their concerns, their, maybe even give input on how to improve things. And so I think that relationship should be no different. You got to watch them like you treat your family. You want to hear from them. You want to get feedback. And I think you touched base on this a little bit too. I work with a similar kind of staff, and we have a lot of respect for what they do. And you got to watch their back, right? Things go wrong, and they may not, have all the answers, or something may not go right either from them or from us. And they watch our back all the time. As you know, we can't work without them, and they work with us. And it's about, if your child does something wrong, once again, in that equation, you don't kick them out of the house. You work with them, you fix them, you train them, you educate them, you discuss with them, as you mentioned, communicate with them, and wonderful things happen. It flourishes, and you mature together. And I think I see a lot of that in both the office setting, like you mentioned, the OR setting, because you're working with them. They're an integral part of you. And so that's a lot of what we think about as leaders. And I'm not sure if you see it the same way, but I saw that beautiful analogy as we are, fathers at home and so forth.
No, for sure. I think that's one of the most important things to realize, is that each of the people on your team is an individual that brings something different to the table, really different experiences, different insights, different ways to perceive things. And so I think it's and I see that with my kids too. They're their own people, and as they've grown and matured, we don't always see eye to eye, but that's okay. I want my kids to have an opinion. I want the people on my team to have an opinion, and it doesn't have to be my opinion. And I think that's what makes people truly engaged, is understanding that they have a voice. And if you're constantly squelching that voice and not allowing people to understand that the importance of what their voice brings to the table, then they're not going to want to be part of your team. And I think that's where people tend to leave, or tend to move on.
Yeah, that's a good point to mention too. If you can't do that properly, people do leave you. And perhaps, I'm sure I've seen many examples as well, with colleagues either during residency, fellowship, or even currently as an attending and as a chair or future chairs. You have any examples maybe where you work with colleagues that didn't set such a good example, or weren't very professional about things? What are your thoughts on this? I'm sure you've seen anything like that, or any potential traps that our audience can avoid or be careful about when they're, working with their staff. Any examples you can think of?
Yeah. Obviously, I can see examples of myself that I feel like I've
sure
made two rash decisions. I've seen it in others as well. That's just part of being human. We sometimes jump to conclusions, or we jump to decisions. I think what's important is to and what I've learned is to take a step back in those situations. It's hard to do sometimes, but avoid sending an angry email. I've seen that where an angry email gets sent out and someone's really upset about something, and then when you read it again 24 hours later, it's not really something you meant to say, or the way you said it. And I think that's where people get in a lot of trouble. And so I think my wife always told me, and she's an attorney, she always says, sleep on it, think about it tomorrow. And if it's something you really feel strongly about, send the email. But if it's not, don't do it in the moment of when you're upset. And I think that's really good advice. I think how we communicate, again, going back to communication, how we communicate is really important, because I think Maya Angelou said it best, where she said, I won't exactly remember what you said, but I'll remember how you made me feel. That is so true in so many aspects of life, not only in your relationship with your kids, with your friends, with your spouse, but with your coworkers as well. People really remember how you make them feel being part of your team. And if it's where you're saying things that make them feel unimportant, or make them feel unheard, or make them feel like they're not bringing a strong contribution to the team, they remember that. And I think that's a hard thing to fix once it occurs. So I think it's one of those things where you need to understand that how you say things, what you say, is really important. And sometimes it's having that emotional intelligence to understand what those things are that you're saying that are coming across poorly. And so I think it's really important to be open to feedback about that. So when I have people on my team that are expressing themselves in ways that are either grating on other people or affecting their relationships with other people, my goal is to try to educate them from an emotional intelligence standpoint about how that's being perceived, and so that perhaps they can have some introspection about what that looks like, and see if there's a way that they can change how they approach that. And again, I think there's generational differences in how we feel about feedback, but I think what's really important is understanding that we all have to have some level of feedback. We all don't do things perfectly. Certainly, no, I don't. And there are a lot of people in teams that haven't either. But I think at the end of the day, we all want to get along. We all want to have a cohesive team. And if we don't have a cohesive team, I think there's some pathology there that needs to be addressed. And the person may not be a good fit for the team.
Yeah, for sure. And, I think a lot of this has to stem with us being the best of ourselves. And we're often hard on ourselves. I think you mentioned you've made mistakes yourself and acknowledging that, but then listening to others, your wife or your staff, so we can become best. I think, part of the things that built into our career as professionals are a little bit type A or hard on ourselves. But if you just take that a notch above and willing to say, yes, we're fallible and that's okay. And it's okay to pause, think, reflect, correct, forgive yourself, even forgive others, because that's what makes a good leader. And knowing you're imperfect, they're imperfect, and taking that, with one day at a time. It's a marathon. It's not a sprint. And you're right. You often walk away in a stressful situation, saying something that you probably didn't mean to say, just like you would in a relationship or friendship. And we often need to hold our thoughts and recalibrate a little bit. So I think you mentioned a very good point. That's wonderful, Tim. I appreciate that. I want to change gears a little bit, but really in line where we're talking about leadership, and you mentioned a lot of things with communication. Obviously, that's very important. But a lot of the leadership and a lot of those skills you talk about come along with managing your personal life, managing stress, managing your interests and hobbies, and balancing all that so then you can become the best you can be. You work very long hours, obviously. You continue to do that in a different role now as you work more into administrative leadership, but also you're still working as a surgeon. Surgeons, physicians, we all struggle. Anybody in the healthcare community, whether you're a dentist or healthcare-related fields, a lot of stress and burnout. What do you do to avoid that so you can really be the top-notch at work and be that leader you want to be? What do you recommend for others?
I am probably the most guilty person of not following good advice on that. I have definitely been the victim of overworking, not taking time for myself, not taking time for my family, and it takes a toll. And I've learned that over the past 14 years in being in practice. And what I've learned is that the most important thing you have to think about is your family and spending time with them and making time for them. And if that means that, you have to miss a meeting or you have to miss, a journal club or something like that because your son needs help with math homework or something like that. Those are the things that at the end of the day are most critically important. So if you have a happy home, it makes your work life a whole lot easier. And I think also taking care of your health and what you eat and exercising are critically important. I love Peloton. I'm a big Peloton fan. I do Peloton boot camps. Just Sims is one of my favorite people. And so I am a big believer in that exercise is critically important to not only your health, but your happiness. And so taking care of yourself and your family I think need to be your top two priorities. And that's sometimes going to come at the expense of other things at work that you need to say no to. And I think in this day and age, people are much more understanding of that than they used to be maybe 10 years ago. And so I think people understand that in order for you to have a long career, not only in surgery, but also in leadership, you have to have personal accountability to those important aspects of your life. And I think if you're in an organization that doesn't appreciate that, and those things are important to you, that may not be a cultural fit for you. And so I think that making sure that you find a culture where that values those things as you do is incredibly important having a long career.
Tim, I'm really glad you mentioned that because obviously there's a growing community outside of the medical world talking about health, wellness, nutrition, taking care of yourself. But we're always taking care of other people and advising those, our audience, our patients about that. I think you hit it spot on. Taking care of yourself, taking care of your family, balancing your priorities because, you have that work hat and the family hat. You mentioned exercise. I hit the gym for, 4 to 6 days a week, if not many, all 7 days. And you have that sense of, we all get this endorphin. It's sort of a meditation. Some people do meditation, they do yoga. You need an outlet to focus, to release, to stay fit because that whole mind-body connection, I think is a big deal. We don't talk about that as much. I'm certainly not an expert, but I think a lot of us in the health community realize that. And you're right. When we were in residency and fellowship, there was no limitation on the number of patients we saw. You had 200-hour work weeks when there was only 100 hours in the week or whatever we had. And you're right. I think society and the field, thankfully, has really allowed us in the medical profession to take a little breather and respect that because it is a marathon. Whether you're seeing patients all your life or you transition to something else from medicine like you are slowly, it's still a marathon because I think we're eternal learners, eternal workers one way or another doing something. And you can't do that without taking care of yourself. And then becoming happier, healthier, wiser. And that all ties in with our theme is really how do you become better leaders? It's the full package. It's not just the image. And Tim, I have to say, you mentioned about you being not so good about taking care of yourself, but man, you must be grace under pressure because I could not peg that about you. Every time I see you, you're well balanced, you got it under control. And maybe that's a skill we doctors have is we know how to kind of manage and disguise our personal internal strifes and stress. And it's okay to talk about that. And I think that's what we need to do too, is within colleagues, with loved ones, that helps, right?
It is. I think that's where my relationship with my wife is so critically important. She is the best life coach I could ever ask for. We've been together since college and she knows me better than anybody. I really look to her a lot for advice because she knows me best. And I feel like we have a good dialogue because of that. I think when you're right. I think you need to maintain some level of calm. And I think that as a physician, it's important to have that calm. I think if you were someone that flies off the handle easily, I think you're looked at it as someone that's not as reliable. And especially in the operating room, for me, I want everyone to see me being the calmest person in the room because I want to make sure that everybody knows that I'm understanding what's going on from not only the patient's vital signs, but also what's happening within my realm of what's happening in the part that I have open, trying to put everything back together. I really need to be seen as the person that not only is calm, but has the plan in mind and knows where we're going and making sure that everything is happening in the safest possible way for the patient. I try to exhibit that not only in the operating room, but also in the clinic, just trying to make sure that I keep that calm keel throughout not only the patient experience, but also the experience with my team. I want my team to look to me as someone that can come up with a calm decision, come up with the right decision without putting emotion into it. And so sometimes that's a struggle because sometimes it's hard, especially if you have lack of sleep. It's a very stressful situation, and you have people coming at you with asking questions left and right, and you're having to move from, this patient has called and has this issue, and this patient just called and has this issue. With this person waiting, you're 30 minutes behind in clinic. Sometimes you just gotta say, all right, this is what we're gonna do.
Yeah.
And so you realize that you can only take care of one thing at a time. But again, blowing up and yelling at people doesn't change the situation.
Not at all.
It makes have I been guilty of that? Sure. I think it'd be hard to find a physician that's not been guilty of that at some point in their career of having that happen. But what I found is that if anytime I've ever done that, I've lost my patience, it looks poorer on me than anything. And so I try really hard not to let that happen and to really try to maintain a calm and, like I said, open communication environment. And trying to maintain that calm under pressure, I think it's just critically important to being a good leader. You have to be seen as someone that isn't a hothead.
That's wonderful, that you acknowledge that. And I didn't share with our audience and with you, but one of my first positions here with local HMO. And you go through this 2-week onboarding, and you're a new physician out of residency. It was one of my first positions. And they gave us a Mickey Mouse or Disney analogy, right? And I don't know if you remember Disney, you've been to Disney World, but everybody's happy in Disney. All the characters are happy. All the staff is happy when they come there. But there's an underground under Disney where they're all changing their costumes. They're popping up in various places. And the story is you can have any of the strives you have. You can have any troubles you have at home, and you can be unhappy behind stage, behind the scenes, underground, where they're doing all the change and makeup for the characters. When they come up into the park, it's game on, smile on, and you don't show that your feelings. And because you have that mask on, you have that Goofy or Disney character face on, no one knows what you're really feeling. I think we play Disney every day because we're kind of calm under pressure. We're putting the smiley face on. We don't bring too much of our personal lives to work because we are there for other people. And that recalibration happens minute to minute, day to day. But, part of this is like you said, you rely on your life coach, whether it's your wife or your friends or yourself, that self-reflection meditation. But I love what you had to say. And I think, sharing with everyone that, you too, at the top of your game, doing what you do, the level you're at, the number of years of experience, that we still have the same thing somewhat every day that we did 20 or 15 years ago. And to let everybody know that this is okay. And this is part of the learning process and the evolution of becoming a great physician, a leader, parent, father, colleague, et cetera. So thank you. Yeah, that's very, very true.
We're all human. And I think that's what people refer to as genuine leadership. And that's what I always strive for is being genuine. But I'm a fallible person just like anybody else. And because of that, I'm going to make mistakes. But I'm going to be very accepting of others' mistakes as well. And we have to understand that we have to recognize those and be able to allow and have feedback for those mistakes. I want that feedback, and I want others to be able to accept this feedback as well.
Yeah, for sure. So I want to ask you, obviously you have a lot of experience. You have some great wisdom here you share with everybody, yet you're learning, right? You're finishing your MBA. You started over a year and a half ago. Congratulations in advance. I think I told you already when we met a few weeks ago, and you're almost there, obviously. And what made you decide that you need that? A lot of our folks and our colleagues are doing MBAs or other degrees. What made you decide to do that? And what do you think you're bringing to the table after all this extra education you have?
That's a great question. And I asked myself the same question as why would I want to do this? Because it is a huge time commitment, huge financial commitment. At the end of the day, there were two things I wanted to get out of the MBA program. One is an understanding of financial language. I never had a finance course. I never took an economics course. It was a language that was completely foreign to me. But it was becoming more incredibly important to understand how to read a balance sheet. What's profit? What's a loss? What does EBITDA mean? These are things that I had never heard about, learned about, never had a course about in college or in medical school. And we never really talked about it in residency or fellowship. But all of a sudden, I'm thrust into practice, and I have to understand the importance of profit and loss. So for about 12 years, I really didn't understand that language. I have an intimate understanding of that knowledge, intimate understanding of that language now. And so I understand very well what profit and loss are and how those things really impart decisions that are made for your practice, for your group, for your team. And now I have not only an understanding of that language, but an appreciation for what those things mean for longevity of a group or a longevity of a team. And then how to grow that team, what aspects I need to tweak, what aspects I need to really support and grow. So one is, I think the first thing I really want to understand is that language. And two, I want to be a better leader. I think there are some people that are born with natural tendencies for leadership. And I think there are other people that really learn it along the way. I feel like I've always wanted to be a good leader, to be able to help bring people along, because I really enjoy building teams and bringing teams together. But I think there are aspects of that I really wanted to improve on. And so through this, doing my EMBA, I've gotten a ton of experience in not only being part of a team, managing projects, but also just learning how to work with people from across different spectrums of industry. So we all come from different backgrounds. And so being able to complete a project in a short period of time with people from different backgrounds has been incredibly eye-opening in how to work together and accomplish a product that you're proud of. It's really been an incredibly eye-opening and incredibly valuable experience for me. And so I think those two things, being able to improve working relationships in a group and then being able to understand this language now, I think those are two things that fundamentally I would have not been able to get through practice alone. And so I think it's been very valuable to me from that standpoint.
Tim, that's wonderful. And I'm glad you touched base a little bit about the language of finance. As you know, I work in private equity and look over several practices. And one of the things we say is no money, no mission, right? Because if you don't understand the value of finances and balance in your career, and those things are failing, that's part of leadership, because you can't then follow your mission and your goals. You can't strive for that. And so that plays a role, just like a budget does at home. If there's stress in finances, there's stress in the relationship, there's a breakdown in the leadership, and there's lack of confidence in that leadership, right? So I think all these things circle together very well. And boy, hats off to you that you're finishing this while you're managing a really, really busy career and family life. And I'm sure that's certainly going to help you. And, really for our audience to know that we never stop learning, and you got to, get whatever skills you need to supplement areas that either you're excited about, to learn about, deficient in, and constantly grow. And that's part of what leaders do, right? It's they grow, they learn, they adapt. And I just love hearing these stories of folks like you, that just very inspirational, even for me, to say, sometimes you do want to sit back and take a little break and say, well, I came pretty far. This is not so bad. But I think it's in our DNA to constantly go for a little more. So, no, thank you. Thank you for sharing.
I think that's really important. As physicians, we're always constantly learning and to be open to learning new ideas and new ways that we're approaching things. And that's, we do that with reading journal articles and keeping up to date on what's going on in our fields. I think we're just constant learners. And I think that's what makes physicians an interesting group of people, because we constantly want to learn more and know more about not only what we do, but other aspects of medicine as well.
Tim, we're coming near to the end of our first episode today. I want to talk about a few things before we leave our audience. What advice do you give for those that are completing residency right now, right? The theme of our show is T-minus attending. They're entering their first job. They're going to make mistakes, just like we have, just like our children do, no matter what we tell them about wearing a helmet or looking both sides of the street before crossing the road. What would you like to tell them at the end of the day here?
So I think what's important, and I tell a lot of the residents and fellows I work with, don't chase dollar signs. Chase what really matters to you, what you're really passionate about. Because at the end of the day, that you're going to be spending a lot of time doing your job. And if you don't love what you're doing or really enjoy what you're doing, it can be really miserable. And so what I've tried to do in my career is really focus on those things that give me a lot of meaning and purpose in my life. And that's where, being a pediatric and a microsurgeon, being able to help kids get function back or restore function or prevent loss of function, that has been something incredibly rewarding for me and has given me a lot of purpose in my career. And so working towards that and trying to really bring that to another level at UCLA as their chief of pediatric and microsurgery, I'm excited about that because I feel like it's something that I've really been able to focus on and really be able to grow. And so what I would say is if as you're coming out of residency, as you're coming out of a fellowship around the practice, look for a practice that allows you to really focus on the things that you find most valuable for yourself. And sometimes that's hard to find. And I think it's also important to understand that you may not make the right decision initially. I think the statistic is 70 to 80% of people will shift from their first practice to another practice in the first couple of years. I think that's okay because you don't know, right? You don't know all the ins and outs of what things are going to be like when you come out as an attending. And it's okay to say, this was a good experience, but I think this isn't the right experience for me long term. It's important to understand that you're not locked into one decision or another, you have to be open to understand that there are opportunities out there that may be more in line with what your values and goals are for your life.
I think those are great points, Tim. Not chasing the dollars. I think early on, especially students these days, residents, they're coming into the field with a lot of debt. As you know, many medical students rotate with me. I don't know if they've told you that, but it's about $500,000, which, is exorbitant, and it's very difficult, as you know, to take care of that. But if you're not happy and you're miserable paying those loans back, and you're going in every day thinking, this is not fulfilling me, and initially thought it would, going into 30 years of education, then you really need to really reevaluate, because you got to go in for that purpose and wake up every day, because once again, it's a marathon. I think that's great advice. If you want to reach the epitome of your career, whatever that is, if you're shifting in medicine or staying in medicine, to continue to find what that is, because it can be a moving target as well. Just like that first job may not be the right job, the opportunities sometimes will approach itself, and you want to be a little uncomfortable and try it out. Go for that MBA, try that new job, take on that new committee member leadership, experiment, fail, fall. That's okay. That's part of it. We've all done it, and I think that's a great way to sum it up. So I appreciate it, Tim. This is wonderful having you on. Congratulations on the new position. I'm going to miss you here locally and here in Phoenix, Arizona. I'll have to visit you out there in LA.
Please do.
It's going to be a wonderful ride, a wonderful journey for you.
Thank you, Shishir. It's been a real pleasure. And I always look to you as a great friend and mentor. And I really look forward to maintaining that friendship long term. I really, really appreciate you.
Thank you, Tim. Appreciate it.